Emily, we're 2 years into 988, a shortening of an essential service, I think we can call it, in Eastern Iowa and really anywhere that people are in need of mental health assistance. What has Foundation 2 Crisis Services seen in these last 24 months since this relaunch, this reintroduction of the number, and how do you think things are going here 2 years into 988?
Yeah, well, the 988 rebranding that happened in 2022, for the most part, has gone really well. It's a service that we have been providing for 54 years, and so it was an expansion for our team as well. We continue to see volume increase, and we look at staffing, we look at data points, we look at numbers, really wanting to make sure we're providing people in crisis the support they need.
How do you measure effectiveness? Is it lessening of repeat call? What is the measurement when it's a literal lifeline over the phone? How do you measure how well the service is going?
Well, one measurement is, are people reaching out for help? We saw a huge increase and we continue to see an increase. And what that tells us is that more people are reaching out for help when they need it. In a perfect world, no one would call because no one would be in a mental health crisis where that they couldn't manage on their own, but that is not the world we live in. And so people being able to connect with us, that is one measurement, is volume increasing. We also look at length of call. We look at level of crisis when someone calls, and then when the call has ended. We look at safety planning. We do follow-ups, and so are people better with a follow-up than they were when they initially called? There's a variety of data points that we look at, but people should be able to reach out anytime they need us, as many times as they need us, and so we do have repeat callers. And quite honestly, every time someone reaches out for help to us and we can successfully support them over the phone, that's a trip that doesn't go to the emergency room. That's someone who can safely stay in their home with the support that they need. And that to us is definitely success.
How do you measure success the next 2 years as we get into year three and year four of 988? Again, you said in a perfect world, you get no calls, but you're going to get calls and you're going to get thousands of calls. How do you measure success as you're trying to combat something that there's still a long road ahead with?
Yeah. So, every time someone reaches out for help, we think that's success. And if we can keep our answer rate up in the, 90s, 100%, that's successful. That when someone calls, they're not sitting there waiting for a counselor. A counselor answers the phone right away, provides them the support they need, provides follow-up and kind of tools and skills for how to support themselves moving forward. That to us is absolutely success. Call volume will continue to go up, and we're excited for that challenge, and we're ready to make sure that if people need support, we're the team that's here to help them.
How do you measure success the next 2 years as we get into year three and year four of 988? Again, you said in a perfect world, you get no calls, but you're going to get calls and you're going to get thousands of calls. How do you measure success as you're trying to combat something that there's still a long road ahead with?
Yeah. So, every time someone reaches out for help, we think that's success. And if we can keep our answer rate up in the, 90s, 100%, that's successful. That when someone calls, they're not sitting there waiting for a counselor. A counselor answers the phone right away, provides them the support they need, provides follow-up and kind of tools and skills for how to support themselves moving forward. That to us is absolutely success. Call volume will continue to go up, and we're excited for that challenge, and we're ready to make sure that if people need support, we're the team that's here to help them.
What are the type of things that stand in the way of answer rates? It's around 87, you said 90% beat
Yeah.
rate. What keeps it from being 100% ideally?
Um, Most of the time it's volume. It's that someone calls, they need support. If all of our counselors are busy, let's say they're on some difficult calls that maybe are lasting longer than kind of some of our typical length of time, then that call will get kicked out to a backup center. It's never a system where you leave a message. It's never a system where there's an answering machine. You will get pushed from center to center until you have someone answer. And for us, there's 2 centers in Iowa, and then it would go to a backup center. But it's usually staffing that causes the challenge of not catching 100% of every call.
So every call is being answered, just maybe not necessarily in Cedar Rapids or at the other center. It's being answered by somebody somewhere.
Absolutely, absolutely. Every call is being answered, and in Iowa, we're sitting right around 90% most months.
How is the foundation to staff doing? How do you deal with, do you even try to retain, just making sure that they are being taken care of too? Because as you're dealing with mental health crises, you're taking on those yourself. We're all human, and it's, I imagine, impossible to take some of those calls and not feel a little bit of the weight start to add up the more you take them. How is your staff doing, and how are you handling that?
Yeah, that's a great question. I appreciate you asking. We care deeply about our teams, and we know that if they're not mentally well enough to manage what's going on in their own lives, then they can't be as supportive as they need to be for people who are reaching out for help. So we have a pretty short span of control. So supervisors to number of counselors. We do check-ins with them. We're available after a really difficult call. Some calls are more challenging than others. And so making sure that our teams know when they can reach out, how they can reach out. We debrief on difficult calls as well. In our new headquarters space downtown, we have a restoration room where between difficult calls, staff can go, where they can spend some time by themselves and recalibrate. Staff retention is incredibly important to us, and we want to keep good people. We have a very generous time off policy. We have floating mental health days that our teams can use. We ask them often, what is it that they need to be able to continue to do this critical work? And as an administrative team, we do our best to listen and provide them support.